Staffordshire County Council's Joint Commissioning Unit has been working in partnership with Nosal Surgery on a project to give people more control over their healthcare. Doctors and care leaders met recently to explore positive ways GPs and Staffordshire County Council can work more closely together to provide services to patients and service users.
Thank you again all for coming.
The aim of this landmark event was to explore positive ways GPs and Staffordshire County Council can work more closely together to provide services to patients and service users.
County Council needs to be absolutely side by side with health, but this is about a more fundamental, holistic approach to actually understanding what an individual's life and their health circumstances look like, to allow people to manage their own circumstances and actually take responsibility for their own circumstances. That little bit more, I think, is hugely exciting.
Today is about developing a healthcare system that gives people information, that enables you to take responsibility for your health, so that it gives you the same mechanisms for health as you can for your wealth. So you can have a bank account and look after your own bank account. Why can't you have a healthcare account and look after your own health? What we need is the people who make decisions to have the information available to them at the point they make decisions. There should be freedom of information so that you've got all the information to you, so it's your health and your responsibility.
The conference was also a chance to show innovative forms of technology aimed at letting patients take more responsibility for their health and giving them the confidence to play a more active part in managing their own healthcare.
I'm going to share with you how our system works and what we're planning to do. So the whole idea is to put all the information and intelligence that one needs in that process at both the patient's and the care provider's fingertips to make things a lot easier and allow for more automation to happen. In addition to their risk profile, they have their personal health record with them. So they can A, see their history, B, if they do any measurements at home or have devices like this that they might be using for that, and then they can just upload that into the system for themselves to track, but also for the care provider who's sitting in the surgery when they next look at their profile.
Zero Solutions, we're a small company based here in the West Midlands, but we have a big focus in terms of research and development around mobile health. There's no mechanism, strong mechanisms, and also very easy mechanisms for a user to actually give that feedback to the clinician themselves, and then for the clinician to then consolidate that feedback and then do something about it. Giving them the capability of actually feeding back either their quality of experience, or taking the healthcare readings in a very easy manner.
Well, what would I want if I was a patient? I'd want something that I already know how to use, so I don't need training on how to use it. This is all about the patient doing it themselves. The patient monitors it themselves, but it's at their own time.
The future means that individuals will have to take more responsibility for looking after themselves. And the technology and the holistic approach between social care and health that we've just seen is a tremendous step forward in that.
The work taking place in Nosal is part of a county-wide project aimed at making these systems available to GP practices across the county. The overall aim is to work closer together with health and provide the best outcome possible for patients.